somewhere over western Germany, February 1944. The B-17 flying fortress shudders mid-air as black clouds bloom outside its fuselage. Flak steel fragments slice through the sky like hornets, ripping into aluminum skin and human flesh alike. Inside the bomber's belly turret, a gunner screams, not from fear, but from a jagged shard that tore through his lower chest. Blood pools fast on the cold metal floor. No one can help him, not up here, not yet. 12,000 feet below, at a US airbase in England, a flight surgeon waits beside an ambulance. His hands, stained with the memories of too many shattered torsos, tremble as the first bomber limps back to base. Another one follows, then another. But too many are missing. 1 hour later, the surgeon cuts open a flak vest, unauthorized, handmade, stitched with scrap steel. Inside it, a dent, deep, ugly, but no blood. He stares. Then he nods. Somewhere along the line, someone disobeyed orders and saved a man's life. This is the story of a quiet battlefield rebellion, of surgeons who broke rules to stop the bleeding, and the steel vest that saved thousands of American bomber crews. England, 1942. The United States had entered the war. Young American airmen, most barely in their 20s, were arriving by the thousands across the English countryside. They were trained, briefed, and quickly sent into the skies in B-17 flying fortresses, part of the newly formed 8th Air Force. Their mission was clear: cripple Nazi Germany's war industry through precision daylight bombing. Their enemy, not just the Luftwaffe, but something colder, crueler, and utterly impersonal. Flak. It wasn't just a word. It was a fear lodged in the chest of every bomber crew member. Flugabwehrkanone, German anti-aircraft guns, spat shells designed not to hit planes directly, but to explode at altitude and unleash steel shards into the air. A direct hit could rip a wing off. But most often, it wasn't the explosion that killed. It was the aftermath. Hundreds of high-velocity splinters slicing through fuselage walls, bouncing off metal, and finding the softest targets: human bodies. Crewmen were issued leather flight jackets, wool gloves, oxygen masks, and flak helmets, shallow steel domes modeled after infantry gear. But their torsos, their vital organs, their chests and abdomens, unprotected. Inside those freezing aircraft, often flying at 25,000 feet, flak hit like an invisible shotgun. Gunners manning open window positions, bombardiers hunched in nose cones, and radio operators kneeling in the midsection were all prime targets. A single shard could puncture lungs, tear through livers, or rip spinal cords. There was no cover, no shield, just metal, flesh, and prayers. Every flight meant rolling the dice. In 1943, the average survival rate for a US bomber crew completing 25 missions was 1 in 4. That's not myth, that's math. Losses mounted, bodies piled up. And for the surgeons waiting at forward airfields, the carnage was overwhelming. Inside the 8th Air Force surgical units, doctors began seeing patterns. Same wounds, same locations, same outcomes. Upper body trauma dominated every incoming wave of wounded. Shrapnel through the lungs, heart, diaphragm, intestines. Limbs could be amputated. Heads were often saved by helmets. But the torso, unarmored and exposed. They tried everything: morphine, blood transfusions, field dressings. Nothing could prevent the damage. By the time patients reached them, too many were already dying. But among the trauma surgeons, particularly those who had experience in thoracic surgery, a dangerous idea began to take root. What if they could stop the metal before it tore flesh? The answer was obvious. Armor, not for tanks, not for planes, for men. But here was the problem. The US Army hadn't approved any armor for bomber crews. Leadership believed it would be too heavy, restrict mobility, and perhaps most damningly, unnecessary. Commanders feared anything seen as defensive would hurt the aggressive morale of airmen. "You're not here to hide from the enemy," one general reportedly barked. "You're here to destroy him." So the surgeons began quietly experimenting on their own. At several airfields, especially in the 8th and 9th Air Forces, medical officers started sourcing scrap steel, cut from damaged bombers, tools, even supply crates. They shaped the pieces into flat panels, small enough to be worn over the chest and abdomen. Then, using flak vests from British sources or even makeshift canvas pouches, they slid the plates into fabric and stitched the seams. They called them flak aprons, or steel vests. They weren't regulation. They weren't pretty. But they were the difference between a clean dent and a shattered rib cage. At first, only a few dozen was made, distributed to tail gunners or ball turret gunners who were most vulnerable. The first tests were unofficial, but the results were immediate. One turret gunner returned from a mission with his vest's front plate completely warped, a twisted crater pressed deep into the metal. Beneath it, his flight suit was scuffed, but his chest was untouched. Another airman walked off the plane, pulled the vest from under his leather jacket, and dropped it to the tarmac. "That thing," he said, "just saved my life." Word spread fast, among crews, among surgeons, but not among higher command. Because officially this armor didn't exist. In war, the front line doesn't always have trenches. For the surgeons of the U.S. Army Air Forces, their battlefield began when the first ambulance roared up to the medical tent, siren howling, propeller noise still echoing overhead. What they faced wasn't the mud and chaos of infantry wounds, but the mechanical brutality of modern air combat. Shrapnel, burns, torsion injuries, catastrophic blood loss. Men who had been laughing over breakfast an hour ago now arrived shredded, silent, or trembling in shock. These surgeons were soldiers too, but of a quieter kind. They fought not for ground, but for minutes. Each second of bleeding, each breath cut short by a punctured lung, was a battle. Among them were men like Major Dwight E. Harkin, a thoracic surgeon attached to the European theatre, whose name would later be whispered in medical journals. He had spent years performing delicate operations on the heart and chest, skills few possessed in 1940s medicine. When Harkin saw what flak did to airmen, he recognized a horrifying pattern. These were not random wounds. They were predictable, preventable, and lethal. He wasn't alone. Across different airfields, Burtonwood, Bassingbourn, Thorpe Abbotts, surgeons began keeping meticulous notes. They sketched wound diagrams, traced trajectories, and mapped where fragments entered bodies. Time after time, the pattern repeated: upper torso, abdomen, and back. The same areas left entirely unprotected by standard issue gear. The British Royal Air Force had already been experimenting with flak suits, canvas garments lined with manganese steel plates. They were heavy, weighing up to 20 pounds, and cumbersome. But they worked. RAF flight surgeons shared their data with American counterparts. Harkin and others took notice. If the British could protect their crews, why couldn't the Americans? The problem, as always, was bureaucracy. Any new piece of equipment required testing, approval, and procurement through army channels, a process measured in months. The surgeons didn't have months. Every week the casualty lists grew longer. Every day, more bombers failed to return. So, some decided to skip the paperwork entirely. They began building their own. In small workshops behind medical tents, technicians, nurses, and even off-duty mechanics cut and shaped sheets of manganese or mild steel. Tailors stitched them into pockets sewn inside canvas smocks. Some vests were lined with extra padding from parachute material or aircraft seat covers. They were crude, uneven, often improvised from scavenged parts. But they could stop a steel fragment traveling at 1,000 feet per second. Unofficially, these were called Harkin vests, flak aprons, or simply armor. Officially, they were not authorized. But the surgeons didn't care. They issued them quietly, first to gunners, then to radio operators, then to entire crews willing to wear the extra weight. Some vests were distributed secretly, hidden under flight jackets during inspections. In some squadrons, they became a badge of defiance, proof that survival mattered more than orders. And the results spoke louder than memos. Within weeks, flight surgeons noticed a statistical drop in fatal chest wounds among crews who wore the improvised armor. Not zero, but fewer. Enough to matter, enough to make every ounce of steel worth carrying. But word of these vests eventually reached higher headquarters. Reports described non-standard equipment, weight imbalances, and potential interference with parachute straps. The medical officers were reprimanded. Some were told to cease unauthorized experimentation. Others ignored the warnings entirely. In one case, a base commander confiscated a batch of steel vests. 2 missions later, that same squadron took heavy flak over Bremen. When the wounded returned, the medics counted 6 dead who might have lived, and only then did the commander quietly reinstate the armor. It was the kind of war fought not between nations, but between policy and pragmatism. Harkin and his peers continued refining their designs. They worked with the British Medical Corps to study material strength, thickness, and fragmentation patterns. Eventually, the British government approved a formal partnership. American surgeons could now test RAF armor in US bomber groups. The data was undeniable. Crews with vests had up to 30% fewer fatal torso wounds. But by then, hundreds of airmen had already been saved by what the official reports never called authorized. They called it field improvisation. The irony wasn't lost on the surgeons. The army rewarded them for saving lives, but never admitted how they had done it. Still, the work continued. By late 1943, the first standardized American flak vests began appearing, designed from the ground up, using the lessons these men had learned through disobedience. The Army Air Forces named the first official model the M1 flak vest, a lightweight armored garment with overlapping steel plates sewn into a canvas carrier. But behind every approved line of equipment, there was an unapproved act of courage, the surgeon who decided to ignore the manual and listen to his conscience instead. Because for them, this wasn't about protocol. It was about the boy they had promised to keep alive. And that promise would soon be tested in the sky, on the most brutal air mission of the war. To understand the impact of the steel vest, you have to see the war through the eyes of the men who wore it. The ball turret gunner, curled in a glass sphere beneath the bomber's belly. No room to move, no chance to escape, no armor but faith. The waist gunners, exposed at open side hatches, frozen fingers on twin .50 cals, wind howling past their faces as they tried to track enemy fighters while flak burst above and below. The radio operator, kneeling near the center of the fuselage, headset crackling, patching in coordinates while shrapnel ripped through the thin aluminum skin beside him. For these men, fear didn't come from death alone, it came from the randomness of it. They watched crewmates fall without warning, no gunfire, no enemy in sight. Just a dull thud, a burst of red, and a man slumping over his post. Sometimes they didn't even scream. Sometimes the first sign of death was a blood stain spreading across the back of a flight jacket. It was the flak. Always the flak. Crewmen talked about it constantly. Not just the explosions, but the aftermath, the dull percussion in the air, the sudden warmth on a freezing flight suit, not from heat, but from blood. The stunned silence of the others, knowing they'd just seen their own fate mirrored back at them. Some wrote letters home describing the horror, but most didn't. They kept it inside. They drank, smoked, played cards, and waited for the next mission. They knew the odds. 1 in 4 would make it through 25 missions. The others? Well, nobody wanted to think about that. So, when word spread of something, anything, that could tilt those odds even slightly, they listened. The steel vest wasn't a miracle. It was heavy. It dug into the stomach. It restricted movement. But it gave them a chance. Gunners began requesting it by name. The plate, they called it. That thing the doc's making. In some squadrons, it was passed between men. Whoever had the worst feeling that day would wear it. One gunner, Sergeant Joseph Langston of the 95th Bomb Group, recalled a mission over Stuttgart. They took a direct flak burst under the fuselage. The ball turret gunner, a 19-year-old kid from Kentucky, was hit. When the crew pulled him out after landing, they found the steel vest twisted, cratered, but intact. The shard had embedded deep into the plate. The boy had a cracked rib. Nothing more. He walked away. Langston later said he'd be dead without it. We all knew it. That vest, it wasn't army issue, it was surgeon issue. And it worked. The surgeons, meanwhile, were watching the data come in. They didn't have official charts or Pentagon clearance, but they had hospital records, and they had eyes. They noticed that airmen who wore the improvised vests were surviving wounds that would have killed them just weeks earlier. Livers spared, lungs intact, hearts missed by inches. The steel didn't stop the flak entirely, but it slowed it down. It bought time. It gave the body a chance to survive, and the surgeon a chance to work. Even small victories mattered. One more man stitched up instead of zipped up. One more letter sent home from the man himself, not from his commanding officer. But perhaps the most profound impact was psychological. For the aircrews, the vest became a symbol, not of invincibility, but of hope. It reminded them that someone down there cared enough to fight for their lives, even when the high command wouldn't. That someone was trying, not just to win the war, but to save the men who were asked to fight it. In a war of numbers and strategy, of bombing tables and casualty charts, the steel vest was something deeply human. It was not an order. It was a gift, a medic's way of saying, "You matter. I won't let you die without trying everything," and that message meant more to those men than any medal. The United States Army Air Forces in World War II was a complex machine, powerful, massive, but slow to turn. Doctrine, hierarchy, and chain of command ruled every corner of its operation, from pilot training to aircraft maintenance, from bombing plans to the color of a uniform button. Innovation was encouraged, but only if it followed the right process. That process, however, didn't apply to war surgeons on the edge of catastrophe. As early as mid-1943, whispers of non-regulation flak vests began surfacing in command channels. Some higher officers praised the initiative quietly. Others condemned it outright. The official complaint? Unauthorized modification of uniform and flight equipment. Wearing unapproved gear was a direct violation of Army policy. Some squadron leaders worried that the added weight of the steel vests would affect aircraft balance or limit parachute mobility in bailouts. Others believed it set a dangerous precedent. If medics could design combat gear, what stopped everyone else? But the truth was simpler and more uncomfortable. The surgeons were solving a problem that the system hadn't acknowledged fast enough. Reports were written. Warnings were issued. In at least 3 air bases, commanding officers confiscated flak vests made by medical staff and forbade further distribution. One surgeon, Captain Robert Weems of the 91st Bomb Group, later recalled in his notes, "We were told to stop sewing steel into jackets, that it wasn't our job. I asked whose job it was, and no one answered." Yet the data, even in its rawest form, couldn't be ignored. Wound charts told the truth. And the truth was this: men who wore steel vests came back with fewer critical injuries. Survival rates among crews equipped with the unauthorized armor began to diverge from those without it. Eventually, some mid-level officers began to look the other way. They turned blind eyes during inspections, stopped asking where the canvas came from, and quietly made room in supply shipments for manganese plates and extra stitching kits. It became a code of silence, an agreement not written in policy, but forged in blood. Meanwhile, back in Washington, Army medical research units began hearing about the vests through official and unofficial channels. Surgeons wrote letters to senior colleagues. RAF liaisons submitted performance reports. Photographs surfaced of damaged vests with embedded shrapnel, evidence more powerful than any memo. By late 1943, under increasing pressure, the Army Quartermaster Corps began formally investigating the feasibility of flak armor for air crews, but development and approval of a standardized design still took months. In the meantime, bomber groups kept flying, crews kept dying, and the surgeons kept building. It wasn't out of rebellion. It was necessity. There's a term often used in combat medicine: forward improvisation. It means solving a problem in the field with what you have before it's too late. The steel vest was perhaps the greatest example of that doctrine in the air war. Eventually, a compromise was reached. The 8th Air Force approved experimental use of flak vests in select bomber groups, under the condition that data be collected and forwarded to Army Air Force's Medical Command. That pilot program confirmed what the field medics already knew. The armor worked. It didn't make the crews invincible, but it gave them a second chance. And that was enough. By early 1944, the U.S. Army officially adopted its first standardized flak vest, the M1 Armor Vest. Designed with layered manganese steel plates and a canvas shell, it weighed around 16 pounds and covered the torso and lower abdomen. It was based largely on British RAF designs and modified with field input from American surgeons. It was a victory, but it came too late for thousands who had already flown their final mission without protection. The bureaucratic process had caught up to the reality of war, but only after field doctors had defied that very system to force change. There's a bitter truth embedded in every piece of progress during wartime. Someone has to bleed before something changes. In the case of the steel vest, surgeons bled too, not physically, but professionally. Many were reprimanded, their reports filed away quietly, their names left out of official citations. Their reward wasn't medals or recognition. It was watching one more man walk off a bomber, vest dented, chest intact. That was enough, because for them, the war wasn't about decorations, it was about lives. October 14th, 1943, the second raid on Schweinfurt. The day began like so many others for the air crews of the 8th Air Force. Crews assembled in briefing rooms. A red ribbon stretched across a map of Europe, pointing to Schweinfurt, Bavaria, a name that already burned in their memories. Schweinfurt wasn't just another German city. It was home to the massive ball-bearing factories that kept the entire German war machine running. Without ball bearings, tanks would seize, aircraft engines would grind to a halt. It was a strategic target, and the Germans knew it. They had prepared accordingly. As over 290 B-17s lifted into the cold October sky from airfields across England, they carried more than just bombs. Some carried secrets. Within the bellies of select bombers, often flown by crews who had seen what flak could do, were men wearing the unapproved steel-lined vests created by medics. It was the largest combat test the flak armor would face. The bombers flew without fighter escort for most of the route. P-47 Thunderbolts could only accompany them partway before fuel ran short. The rest of the journey, deep into Bavaria and back, would be left to the mercy of the Luftwaffe and Flak. The first fighters struck over Belgium. Dozens of Focke-Wulf 190s and Messerschmitt Bf 109s dived from the sun. But it was the flak zones, carefully plotted and brutally accurate, that did the most damage. Over Aachen, over Frankfurt, and worst of all, over Schweinfurt itself. Black clouds blossomed around the bombers as anti-aircraft batteries lit the sky. The air filled with metal. Pilots called it the flak curtain. Gunners huddled behind plexiglass windows or standing at open doors watched as bursts tore chunks from nearby aircraft. Some B-17 disintegrates mid-air, others limped forward with engines on fire. Inside, chaos reigned. Shrapnel burst through control panels, ricocheted inside cabins, and shredded instruments. Men screamed, passed out from blood loss or lack of oxygen. But in some planes, not all but enough to notice, medics and flight crew found something unexpected after landing. A vest, twisted, scorched, cracked, but whole. And under it a man who should have died, still breathing. When the survivors returned to England, the air bases were silent. 60 B-17s were lost. More than 600 men missing, dead, or captured. Over 100 more bombers returned with severe damage. Some never flew again. Nearly 1 in 5 bombers failed to make it home. But amid the devastation, the surgeons at field hospitals noticed something strange. Of the wounded who had worn the steel vests, far fewer arrived with lethal chest wounds. Some had bruises, cracked ribs, or blunt force injuries, but not the catastrophic tearing Flak was known for. The metal had absorbed or deflected what would have killed. Flight surgeons kept their notes close. Many didn't speak openly. The vest was still technically unapproved, but they wrote everything down. They logged cases, they drew comparisons, they even photographed vest panels with shrapnel embedded deep within, barely inches from the body. One surgeon's personal logbook recorded, "Gunshot-like trauma, right sternum. Vest panel punctured to half depth. No penetration. Airman walked to triage under his own power." Another, "Waist gunner, flak burst 12 feet off starboard. Vest front plate cratered. No thoracic damage. Possibly saved his heart. The Schweinfurt raid was a disaster, a tactical failure. But for the steel vest, it was a turning point. Never before had so many of the makeshift flak vests been tested in live combat under such concentrated fire. The armor wasn't magic. It didn't save everyone. But it saved enough for the surgeons, and the crews, to know they had something that worked. And this time, higher command took notice. Within days, Air Division reports referenced experimental protective gear in casualty assessments. Photographs of damaged vests circulated through medical channels. Rumors reached Washington. And finally, the bureaucracy moved. Not fast, not loud, but the shift had begun. A month after the raid, the Army Quartermaster and Medical Corps began accelerated testing of several flak vest prototypes, many of which directly copied the field-made designs surgeons had been quietly sewing for nearly a year. The Schweinfurt raid cost America dearly, but buried within that loss was a hard-won lesson. You can't save a man after flak hits him, you have to stop it before it does. And that meant armor, even if you had to build it yourself. Late 1943, early 1944. The tide was turning, not just in the skies over Europe, but in the minds of American military planners. The Schweinfurt raid had exposed more than a strategic vulnerability. It revealed a gap between policy and battlefield reality. The loss of 60 bombers in one day shook command confidence. But what caught the attention of the U.S. Army Air Force's Medical Corps wasn't just the casualty numbers. It was the pattern of survivability among those who had worn the unofficial steel vests. Field data, long ignored or dismissed as anecdotal, was now being compiled into reports with real weight. Commanders saw the evidence. Surgeons presented the numbers, and generals, for once, listened. By January 1944, the first steps toward official standardization were underway. The Quartermaster Corps, working alongside the Medical Research Laboratory at Wright Field, began testing several flak armor designs for aircrews. The British had already proven the concept with their flak suit number, 1 inch, used in the RAF's Bomber Command. It was heavy but effective. American engineers modified the design into something more suited to long-range missions. The result? The M1 flak vest. It was made of interlocking manganese steel plates, each approximately 2 millimeters thick, sewn into pockets within a canvas shell. The vest covered the chest, abdomen, and sometimes the shoulders. It weighed about 16 to 18 pounds, heavy, yes, but manageable for most crew positions. The US also developed a flak apron for seated crewmen like bombardiers and radio operators. It covered the groin and thighs, areas surgeons had found increasingly vulnerable during bombing runs. The Army had finally embraced what medics in the field already knew: protection could be portable. By mid-1944, flak vests began rolling off production lines in quantity. Initial distribution was limited to high-casualty air groups, those flying over Germany, particularly in the 8th and 15th Air Forces. Ball turret gunners, waist gunners, and bombardiers were prioritized. Then radio operators, navigators, co-pilots. Pilots, seated behind armor plating in the cockpit, were issued vests last. Crews had mixed reactions. Some embraced the armor immediately. Others worried about the added weight, particularly in emergency bailouts. But as missions continued over Berlin, Hamburg, and Munich, it became clear. Men wearing flak vests were coming back more often than those without. The Army ran the numbers, and the numbers didn't lie. In a classified 1944 assessment submitted to the Army Surgeon General, it was reported that use of flak vests in crew positions with high exposure resulted in a measurable decrease in fatal thoracic wounds. Survival rates increased by as much as 25% in units with consistent vest adoption. For every 1,000 men who wore the vest, hundreds lived who might not have otherwise. The cost of each vest, around $75. The value of a trained airman, priceless. By the summer of 1944, the M1 flak vest was being produced at scale, with over 20,000 units distributed by September. Additional models, such as the M3 and M5, refined the armor layout and adjusted for better mobility and weight balance. Even the Navy took notice. The vest was adapted for naval aviators who faced similar shrapnel risks during carrier landings and anti-aircraft attacks in the Pacific. But none of it would have happened without the quiet, unauthorized groundwork laid by forward-deployed surgeons. Men who had been reprimanded for stitching steel into jackets were now being asked to consult on the design of the standard-issue flak vest. One such doctor, Major Harold Beam, was flown back to Washington in late 1944 to brief medical planners. He reportedly arrived still wearing his own field-modified vest, riddled with shrapnel scars, a symbol of necessity turned into policy. Back in Europe, the difference was being felt. Missions were still dangerous. Flak still tore planes apart. But more airmen survived long enough to jump. More wounded arrived at field hospitals with treatable injuries. A gunner named James "Red" Gallagher, assigned to the 457th Bomb Group, recalled returning from a mission over Bremen where flak tore through the fuselage like a buzzsaw. He wore one of the new Army-issued vests. When he landed, medics cut away his flight jacket. They found a fist-sized dent in the vest's steel plate and a perfectly intact rib cage beneath it. He later said, "I didn't know who made that thing. But I owed them a drink, maybe my life." It's easy to overlook stories like these in the shadow of grand strategy and famous battles, but in the air war over Europe, the steel vest became as crucial to survival as the engines that kept bombers flying. It didn't win the war, but it saved the men who did. And by the time the war ended in 1945, it was clear. Not every hero carried a rifle. Some carried a scalpel, and a sewing needle, and a piece of steel. As the Allied bombing campaign intensified through late 1944 and into 1945, one quiet statistic began to shift. Fewer corpsmen were writing KIA on the chest tags of wounded airmen. Fewer surgeons were amputating limbs or suturing shredded thoraxes. More wounded crews, bloodied, bruised, sometimes burned, were surviving long enough to speak, to walk, to go home. The steel vest had tipped the odds. At airbases across England and Italy, field hospitals began to observe new patterns in casualty data. Cases that once resulted in fatal hemorrhaging now arrived as blunt force trauma. Fractured ribs instead of punctured lungs, cracked sternums instead of perforated hearts. Shrapnel still entered bodies, but less often through the chest and abdomen, and when it did, the injuries were more survivable. The change didn't go unnoticed. Surgeons who had once begged for armor now found themselves invited to write after-action reports, participate in Army Medical School briefings, and advise on future protective equipment. Field medical officers, once seen as auxiliary support, were now treated as direct contributors to survivability doctrine. One internal Medical Corps memo from March 1945 described the armor's effect this way. Reduction in fatal thoracic injuries observed in flak heavy sorties is statistically significant in vest-equipped crews. Recommendations include broader adoption across all bomber groups and incorporation into standardized kit for the U.S. Army Medical Department. This was a quiet revolution. Never before had prophylactic armor, wearable protection for non-infantry, played such a central role in combat medicine. Historically, medical doctrine focused on post-trauma care, triage, surgery, stabilization. The steel vest turned that upside down. It was preventive medicine in steel form. This shift in thinking bled into other parts of U.S. military planning. Command began to seriously consider medical feedback in equipment design, a rare practice in the bureaucratic machinery of war. Previously, armor development had been handled entirely by ordnance and engineering divisions. Now, surgeons were in the room. Their battlefield logs, once seen as niche documentation, were repurposed as data streams. Flight wound maps, thoracic trauma logs, and vest penetration reports became tools in a new field: combat survivability modeling. In other words, not just how to fight, but how to fight and survive. Back in the U.S., comma military hospitals received returning wounded who carried with them the legacy of this evolution. At Walter Reed and other convalescent centers, doctors found that airmen injured while wearing flak vests recovered faster. Internal injuries were less complex. Surgeries were shorter. Rehab times were lower. Survivors could be reclassified and returned to service, or sent home to live full lives. In hundreds of personal interviews, airmen credited the vests with saving their lives. And not just the factory-issued ones. Many remembered the early versions, the stitched steel, the canvas pockets, the strange, heavy weight across their chest that somehow made them feel safer. Some even brought their vests home as keepsakes, a battered piece of metal that had taken a blow meant for their heart. The success of the flak vest also opened the door to a new relationship between frontline medicine and combat leadership. Before the Schweinfurt raid, surgeons who tried to innovate in the field were often ignored or reprimanded. After the war, many of those same men were promoted, cited, or given key positions in post-war military medical planning. Major Dwight Harkin, who had helped pioneer thoracic surgery techniques under fire, would later become one of the foremost heart surgeons in the United States, using lessons learned in bomber clinics to develop procedures still used in cardiac care today. The most profound legacy, though, wasn't written in textbooks or stitched into doctrine. It lived in the silence of hospital tents, the sound of one fewer man gasping for air, one fewer death sheet drawn over a stretcher, and in the memories of surgeons who knew they had helped change the odds, not with weapons, but with steel, stitches, and stubbornness. By the end of World War II, over 50,000 flak vests had been issued to U.S. bomber crews across Europe and the Pacific. What began as an improvised, unauthorized act of battlefield defiance had grown into a cornerstone of American aerial doctrine. But the impact didn't end with VE Day. The lessons born from shredded fuselages and shattered chests reverberated far beyond the European theater. The steel vest, once stitched together behind medical tents by under-resourced surgeons, became the ancestor of every piece of modern body armor used by soldiers, aviators, and law enforcement today. In 1950, as U.S. forces entered the Korean War, the Department of Defense issued a new standard, the M1951 Flak vest, directly derived from the World War II models. It incorporated advances in material design, layered nylon and ballistic-resistant fibers, but the philosophy remained the same. Stop the fragment, save the soldier. Vietnam saw even wider use. By the 1960s, flak vests were worn not just by bomber crews, but infantry, helicopter pilots, and artillery operators. The lessons from Schweinfurt and Bremen had scaled across warfare. Protection was no longer a specialty, it was a requirement. The evolution continued into the 21st century. In Iraq and Afghanistan, body armor became not just essential, but transformative. Kevlar and ceramic plates offered protection from rifle fire and roadside bombs. Tactical vests, mole systems, and advanced trauma pads all had their roots in the World War II-era steel vest, not in concept, but in urgency. That urgency, the need to act fast, adapt on the field, and protect life at all costs, had been proven in blood over the skies of Germany. And so had the role of the surgeon as more than a mechanic of broken bodies. For decades, the U.S. Army Medical Department studied the long-term data from the air war. The effectiveness of flak armor became a central case study in preventive combat medicine. Medical schools incorporated the story of the World War II flight surgeons who had risked careers to save lives. Their decision to defy orders became an example of moral courage in military ethics courses. But for the men who had worn the armor, it was never about policy. It was about the moment the burst of flak struck, the moment they looked down and saw a dent instead of a hole, the moment they realized they'd get to go home. Some of those vests survived the war, now displayed in military museums. Others were brought home, left in attics, handed down, or buried with the men who wore them. One such vest is preserved at the National Museum of the United States Air Force. Its steel plate is warped, cracked, a deep crater pressed into its center. Next to it sits a photograph of the man who wore it, smiling, alive. The inscription reads, "This vest took the hit, so he didn't have to." The legacy of protection born from those improvised vests continues in every armored Humvee, every plate carrier, every reinforced flak jacket worn in modern conflict. But deeper still, it lives in the doctrine shift it forced, a permanent reminder that the job of the military is not just to fight, but to preserve those who do the fighting. In that sense, the steel vest changed warfare forever, not through destruction, but through survival. War is often measured in territory gained, missions flown, enemies destroyed. But sometimes, its most meaningful victories are measured in lives not lost. The story of the steel vest isn't about a weapon. It's not about a general or a grand strategy. It's about a quiet war fought behind the front lines, in triage tents, surgical bays, and the long shadow of the runway. It's about medics and surgeons who looked at torn bodies and said, "There has to be another way." They had no orders, no budget, no blueprint. What they had was conviction that saving even one man was worth bending the rules. They didn't wear rank on their collars, but they carried something heavier, the burden of knowing that every man they couldn't save was someone's son, brother, husband. So they stitched steel into canvas, not because they were told to, but because they couldn't stand not to. The flak vest didn't win the war, but it did win battles, one body at a time, one heartbeat preserved, one crewmate who stepped off the bomber instead of being carried off it. It taught us something deeper than tactics, that innovation, in war, doesn't always come from above. Sometimes it comes from the blood-soaked hands of a surgeon who refuses to accept that death is the only outcome. In that refusal, in that quiet rebellion, they changed history, not with a bang, but with a stitch.